Welcome, everybody. I think we're going to go ahead and get started with our session on health and wellness with pulmonary fibrosis. So it's good to see everybody in a crowded room and only standing room left. So my name is Tracy Lucart. I'm one of the ILD physicians at the University of Alabama, Birmingham at UAB. And so I have the great pleasure of introducing all your speakers to you today. And so I think this session is very important. We're going to talk about exercise and nutrition and all the things outside of the lungs that we need to do to keep ourselves healthy as we battle this disease. And I always tell my patients that from personal experience, the patients that seem to do the best are the ones that keep the rest of their body healthy, their mind healthy, and keep that positive attitude as they're struggling with this disease. And so our participants today are going to help us understand how to do that better. So thank you for coming and listening. So our first speaker is Carol Bair. She's a respiratory therapist and a clinical research coordinator, and she currently lives in Portland, Maine. Prior to her recent move to Portland, she worked at National Jewish Health for 27 years. 20 of those years were at the interstitial lung disease coordinator. She also just completed her advanced care planning certification, and she is very passionate about patient and caregiver education, and she's going to talk to us about pulmonary rehab. So thank you.
All right. Well, I'm sure everyone in this room knows how nervous I am right now. But this is something I feel so close to my heart is pulmonary rehab. I think that every person who has any type of lung disease should be in a pulmonary rehab. I'll teach you what I know. I'm just going to give you a broad overview of rehab programs here in the United States. And when you get back to your home, if you're not already enrolled in a rehab, please do reach out to your physicians to get orders to participate, because I'll show you some good information here. It'll help in the long run here. So here we go. First of all, I'm so proud of this slide. It's adorable. So for people that don't know, let me see a show of hands. Who in here is in pulmonary rehab? All right. When we meet again, there will be more hands up next time. So pulmonary rehab is an amazing group of people that have been organized to help you. And it's a team. They go over education of your disease, get you enrolled in an exercise program, there's counseling, and then there's self-management for programs that you can do after the more structured program in your facility. The classes are given in a group session, which is really nice because then you're able to engage with people who also have lung disease and support each other. The program's designed to help you manage your work of breathing, increase your stamina and decrease your shortness of breath, and help you give you techniques to deal with your work of breathing. People with PF realize with fatigue and dyspnea that they can see less symptoms of that after they go through or are going through a pulmonary rehab program too. And people need to know that, rehab is the #1 non-medical intervention you can do to help yourself. And it improves your quality of life, and I'll show you a slide about that. So I made this up because of the goals of rehab, pulmonary rehab. It's going to improve your quality of life. It gets you up and moving. It gets you out of the house, which is so important. It improves your exercise performance, your conditioning, and it can improve your well-being. And I think that really says a lot for being around people who also have your same lung disease, because as you know, when you go out in the community, you become the educator for it, which is much needed also. We can help you feel more empowered, that you can get more things done. I like this slide. It seems a little busy, but it's when you have pulmonary rehab in the center, these are all of the things that branch out that this program can help you with. It can help you manage acute exacerbations. There are respiratory therapists that can help you with breathing techniques to help you work through your shortness of breath and your work of breathing. The physical therapist team there are amazing. They help with your physical activity. If you're go into a lung transplant, it's important that you are in a rehab program and that you maintain ideal body weight. And that has to improve your body composition. It also helps with, advanced care planning of what you want your life to look like. And establish social networks. I know I've established quite a few here, and I'm happy to see everyone here. So if you're smoking, stop smoking, and there are programs that can help you do that. And another thing that's really important too is people with pulmonary fibrosis oftentimes aren't on inhalers, but there is a subgroup of patients who may be on inhalers that have a reactive airways disease. So we can teach you how to take your inhalers properly and how to use your oxygen properly, which is another big issue that people oftentimes aren't aware of. So I hope that if anyone's not had a chance, they get a chance to go see Susan Jacobs talk about Oxygen Therapy 101, because it's a lot of good information there. So the goals of rehab, they're different for everyone, but the things we really try to focus on is improving your quality of life. And those things to help improve your quality of life are going to be the physical therapist, the occupational therapist, the respiratory therapist, helping you conserve energy, conserving your energy to do the things that you want to do later. And we say save your energy for the things that are fun. But to help you manage your shortness of breath. And another thing that will happen when you're through this program is it's going to increase your physical conditioning. So your energy levels will increase and your fatigue will decrease. I know it probably doesn't feel like it when you started, but it will as you keep going. People have reported decreases in their anxiety and their depression, and I think that may be a result of the education that's done during these programs. Because not only is it get on a treadmill and work out and adjust your oxygen level, there are a lot of educational classes that are done as a part of this rehab program. Most rehab programs in the United States are for a 12-week program. During that 12 weeks, the team will help also try and get you organized for a maintenance program or an at-home program, so you can continue that activity when you're finished that program, that 12 weeks. So we talked about this a little bit, but exercise increases your energy, your muscle strength, your endurance, so you can do more longer. Bone density, which is very important for patients with PF, that they have their bone density checked, and the medications oftentimes, the steroids, and some people aren't able to eat and drink as they like to get enough calcium, but it'll increase your bone density, ability to fight infection, which is so important, and sleep better, and promote relaxation. So things to do about getting started. So we need to talk to your doctor, and because we need to make sure that you're going to be safe. So when you go in initially, and I'll get to that in a few seconds, but when you go in initially, you'll be evaluated to make sure that you're going to be safe and that you're going to work out in a good environment. Another thing to really, really remember is this is a slow process. So you don't get out there gangbusters and kind of run out of energy at the beginning, and this is a slow process, and the slower you go, I think the better it is for you. Set goals, and set realistic goals. Try to incorporate this into your lifestyle, and I just recently moved to Maine, so things you have to remember are, it's going to be hard to get out and walk around the block in January and February, but you can get in the mall and walk around, and you can do other things too. There are warm yoga classes, there are water exercises, water aerobics, and there are meditation classes that you can go to also. Oh, I did that backwards. So this is really important. When you go in and meet with the initial team, there may be a nurse practitioner on that team also. It depends on how your program's set up at your facility, but we'll go through listen to your lungs. Check clubbing in your fingers. Make sure that, if you have any edema in your legs, sometimes it's not uncommon for people with PF to have heart issues too. So we, do a thorough checkup, make sure, some of these things are addressed. And we relay all of the information back to your doctor so they're kept in the loop of things that you're doing while you're away from their office. And another thing that's very important is cough. So we'll try and teach ways. There's a speech therapist oftentimes on staff in the program too that can help with cough suppression and some cough techniques maybe related to reflux or sinus diseases. We'll go through all of your medications, make sure you're taking them the right way, and answer any questions you have. There's always a pharmacist too that we can have access to if we have questions about that. Want to make sure you know about your disease and treatment. It's so important when you guys go out into your rehab programs, they're set up for COPD patients. But now with more education and more awareness of PF and it being a restrictive lung disease and not an obstructive lung disease, there's more awareness of it. But the Pulmonary Fibrosis Foundation has done a wonderful job of, making sure that we have information available that we can give to others to help them understand what you guys are going through, because it's not a common disease and it's not COPD, and just to make other people educated about it, I think so important. There's also exercise and oxygen assessments that are done. The physical therapists are amazing, and we'll check your oxygen while you're doing your exercise and make sure that your oxygen level stays adequate while you're working out. And it's not uncommon for that oxygen level to really have to increase when you're working out. We want you to get a good cardio workout to keep your other parts of your body healthy. And just to know that sometimes that oxygen liter flow can double easily whenever you're getting that good workout done, but it's important to do. Nutrition and IPF. That is, a nutritionist is a part of the team also, and the things that are really important about that is you have to stay on a good diet. You put food in, creates energy, you're going to need that. People that have respiratory disease oftentimes burn more calories that they're not aware of because the work of breathing burns calories. So you get calories out, calories in, but we have a lovely nutritionist over here who's much more educated about that than I am, but she'll go over all of the information for you. And this looks really busy, but okay, I'm good. There aren't a lot of research trials that have been done for people with pulmonary fibrosis and 6-minute walks, and does it improve your quality of life? And there are tons and tons and tons of that information for COPD patients, but not IPF or PF patients. This one was done back in 2016. And the thing that you look at on here is after 12 weeks, the intervention group that had the exercise tolerance and the control group, after that 12 weeks, showed a deterioration. So you reach your peak, and then you start to deteriorate over a little bit of time. But I think the part that got missed in this is the control group with the exercise group is the disease is progressive. So when you stop that exercise, this disease continues to just march out. So in my mind, this is why it's so important when you get in a rehab program, you continue that as much as you can. Even if it's just get up every day, you have got to move your body and get moving. So there are some research trials that are being done or enrolling now. Boehringer Ingelheim has a study. It's if you go to the PFF website and go to Clinical Trials Finder, you can sort out on that web page what trials are available to you, closest to you. So hopefully we'll get more information about that in the future. Staying motivated, it's a hard thing to do, but just to know you keep pushing yourself, don't give up. You have to make exercise a priority in your life. And again, you'll see the benefits of that every day. Another thing that I really, when I was helping with the support group at National Jewish, is it's so important that you form your team. I mean, you're not doing all of this alone. There are so many people that are rooting for you and pulling for you. And when you get your team together, you're going to lean on them. And, you know, this could be your husband or wife, your kids, your friends, who you pick. Maybe it's a workout buddy, but someone to help keep you motivated and focused on really staying healthy. Because with this disease, you really do have to stay otherwise healthy. You know, get your vaccines and take your meds and stay active and wear your oxygen, wear your CPAP, all of the other things that go with it. But another thing that's so important, I feel very close to, is a support group. And Mark McCormick and Sid Wolf here are amazing people in my life. And they're taking over the support group at National Jewish, and I've known them for years now, and they're just very important to me. But it makes a big difference when you have people in a group that you can depend on and that pull for you. So, and don't be afraid to ask others for help. I think we as humans, we want to help, but we don't know what to do. So if you ask people, then you give them a task, and they're happy to do it. And reward yourself whenever you're setting little milestones. So you can remember all of these. The benefits, assess your goals, what do you want to accomplish? Some people use FIA like a feedback tool. I know one of our friends in the support group, Tom, he keeps a log of how far he walks and what oxygen flow he was on, and he's very detailed like that. But that's how he gets good feedback of what he did 2 weeks ago compared to what he's doing this. So you can do it, and get your cheerleaders all around you. I wanted to just throw a couple slides in here real quick, and I'm not sure that a lot of people know this man, but this is Dr. Tom Petty, and back in 1964, and he is the pioneer of rehab programs and also for using long-term oxygen therapy. So he helped us get portable oxygen therapy and rehab started. He was at the University of Colorado in Denver. He's a pretty amazing guy. He wrote this book, and later in his life, he was diagnosed with pulmonary hypertension and had to go on oxygen. So then it flipped. So this is a great book. You can download it. It's free to go through. Just Google it. But if you've not read it, it's got a lot of good insight. And I'm just going to show you a couple pictures of some of my buddies. And this is Kim Fredrickson. And I don't know if y'all ever got a chance to meet her, but she was an amazing, amazing woman. She's missed dearly. There's my buddies, Mark and Marilyn. But just to show you, you don't have to be in a rehab program running out on a treadmill every day to get out and exercise. So you grab some people, maybe go out golfing. This is a great story. This is a friend of mine, John. He came out to National Jewish, and they told him that he needed to lose weight so he would qualify for lung transplant. And I'm not doing that rehab program. I'm not going in there. So he and his wife, she's like, yeah, you're going to do something. She bought them both trikes. He's got his oxygen there in the back in that basket. And she would make him ride around. And she sent me this picture, and I love it. This is my dear friend Sid Wolf. He and his daughter. His wife is here with him today. But Sid's my hero. He runs marathons, which is crazy, with his oxygen. So there you go. And they're here if you want to ask them about the rehab programs they're in. And I just volunteered you for that, so I hope you don't mind. But I think moving forward, we have to make this accessible to a lot of people. And unfortunately, it's not. Because if you live in a rural area, having access to a group in formal center is sometimes difficult. But we're going to have to reorganize this. And I know Noah over here, Noah Greenspan, he's got an amazing, webinar group and video conferencing that you can go onto. And these things are no charge, and he's doing an amazing job. So there's another phone-based monitoring. Maybe you go in and you get evaluated initially, and then you check in with one of the team members along the way, and we can monitor and make any adjustments. I hope these things do happen. Future research in PF and rehab is Dr. Jeff Swigeris, who's a physician that's the ILD director at National Jewish now. He has a lot of interest in, do larger muscles, fit lower extremities, help with your work of breathing, decrease your work of breathing and your shortness of breath. So he and Dr. Zolma Yunt, we're going to do muscle biopsies and do some research on that, so hopefully we'll get some good information. And another good topic is, does interval training versus endurance training in rehab, does that give us better outcomes? So, it's still a lot that we need to learn, and I think the things that, we as a medical group get all excited when we see numbers and, arrows go up, and the things that are most important are your quality of life and how you want to live your life with this disease. And I cannot stress enough that rehab needs to be a part of it. And one other, when I was doing research for this talk, I found a website that I was not familiar with. It's called livebetter.org. If you go to this website, you type your zip code in, and it will pop up all of the rehab centers in your area that have been accredited. It's pretty amazing. And these are some other resources for you here, too. I think you probably know them. Hey, I know you. And that's all I got.